welcome. Very good morning. You're watching Mirror Now. I am Afrida Rahman Ali. Our top focus at this hour is on Maharashtra, which is by far the worst affected state in terms of coronavirus in India. Remember, in Maharashtra alone, the total number of positive cases inching closer to the 10,000 mark. Mumbai alone has over 6,000 cases. So clearly the worst affected state, and out of the 15 districts that have been identified by the Health Ministry as the worst in terms of hotspots, 3 districts are in Maharashtra alone. So that's the big picture. So we focus on the developments from Maharashtra first. So let's look at the big developments coming in. Looking at the figures, 393 positive cases reported in Mumbai in the last 24 hours. Mumbai is gearing up to touch the 6,000 cases mark, making it the city with by far the highest number of coronavirus cases. The death toll in Mumbai alone is currently at 2,044, with overall 1,200 people also recovering from the virus. So I'm going to be joined by my colleagues Mayuresh, Ganapatye, Neha, Kulkarni and Disha, Shah, each of them tracking various aspects of the coronavirus cases in Mumbai. I want to first bring up the issue of Dharavi with Disha. So in Dharavi, to put out the information that we have accessed, with 42 new cases, Dharavi has of course reported the highest single day rise with 4 deaths. And each day we are reporting these figures that has in a way bypassed the previous day figure. So 42 new cases makes it the highest single day increase. The total cases in Dharavi is now up to 330 with 18 deaths. So far 61,000 people have been screened in this slum area, and which has a total population of close to 10 lakhs. So Disha, coming to you on this, if I may begin by asking you that on a day-to-day basis, new measures are being announced by the BMC. It is extremely proactive in screening these areas. But in terms of containing the virus, what success can we say has been achieved? Because we see that the single-day increase, the figure that we are reporting, is only going up on a day-to-day basis.
Well, certainly, and now if you talk about Dharavi, it is still a major concern, Afrida, because let's not forget, like you rightly pointed out, the population is 10 lakh, and out of those, only 61,500 people have been screened so far. So you are looking at a larger population which has not been screened yet, and that is the major cause of concern here for the BMC, because every day there is door-to-door screening which is happening. Every day, of course, people are going to private clinics if to get themselves screened, and if any patients are found symptomatic, then they are referred to BMC and then they are institutionally quarantined. So all of these are the daily process that's really going on. So yesterday we saw 42 cases being reported in Dharavi, including 4 deaths, and now it has crossed the 300 mark. Now the positive cases in Dharavi stands at 330, including 18 deaths. So here we are looking at a larger section of the people still left being unscreened, is what we understand. So daily that process is going on, and for the BMC it's the biggest challenge to finish this task in the coming month or so. So that is why they are roping in more and more volunteers, health volunteers. They're asking more doctors to come forward so that they can cover maximum houses in a day, maximum affected areas. And another point to note here, that every week we are seeing that in Dharavi itself the containment zones are increasing, because as in when they are doing the screening process, they are coming to know that how there are positive cases specifically from the unaffected areas as well. So that is also another major cause of concern for the Dharavi. For the BMC. Today as we speak, there are about 2,100 people who have been home quarantined as we speak, Afrida. Out of course 61,000 population that the BMC and the other doctors have screened so far, approximately 1,900 people have been institutionally quarantined. So institutional quarantine means that people who cannot be home quarantined, because as we all know, Dharavi is a congested area. Many people live in close proximity where social distancing is not possible. So there the BMC have set up beds specifically, for people who have to be institutionally quarantined. So right now the capacity is close to 2,300. Now the BMC is further planning to increase that to 3,000 beds in Dharavi Sports Complex itself. BMC has also acquired a couple of private schools inside Dharavi itself, where they are, where they have put up 700 to 800 beds. So this is what the BMC is taking the precaution on the ground level. But the major concern is that at least over and above 9 lakh population still is left to be screened. So that is the BMC's major concern at this point.
Right, because of the density of population, it becomes a huge challenge. Even though from time to time you have been giving us updates on the measures taken for door-to-door survey, or whether it's the opening up of private clinics, measures are being taken. But like you mentioned, the challenges are huge in a slum area like Dharavi. But overall, Disha, if we can zoom out to the entire picture in Maharashtra, just look at the figures. It's 9,318 at the moment, very close to the 10,000 mark. In the overall numbers that we have of India, standing at 31,332. So it almost looks like 1/3 of these cases are from Maharashtra, which is inching closer to the 10,000 mark. Which are the major area of challenges for the Maharashtra government at the moment?
Well, at this point in time, if we talk particularly about Maharashtra, which is inching closer to 10,000 mark, definitely few districts really remain to be a major concern and plus challenging for the government as well. For instance, Mumbai, if we start off with, if you talk about nearly 10,000 cases in Maharashtra, Mumbai alone records nearly 6,000 cases. So you can see that how Mumbai has become the hotspot, and specifically with larger number of red zones in the entire state. So this is, of course, Mumbai remains the biggest concern. Then if you talk about Thane district, is another concern, which is of course by large seeing increase in numbers. Pune is the second, of course, city which has been recording steadily increase in the number of cases. So that also becomes the biggest concern. And keeping in mind, of course, all of these cases that have been increasing, the Maharashtra government did not, as we all know, that did not even bring in any relaxations as far as within these hotspots or red zones are concerned in such cities, because they are seeing that every day the cases are increasing. Specifically, cases are also coming in from the areas that have been unaffected till now. So how this virus is actually spreading across, and the government also says that measures are being taken, keeping in mind that how the cases are increasing. They are actually taking over, empty places, empty buildings, empty schools, so that they can put up maximum beds they can. Maximum beds can be made available. They are also trying to ensure that most of the medical equipments are there at this point.
Right. And on that point, I want to go across to Neha Kulkarni as well. But before that, let's just tell our viewers here that what Disha was talking about, creating infrastructure now, creating more beds, given the huge numbers, that's a focus for the Maharashtra government. A treatment center is being created in the exhibition ground by the MMRDA in Mumbai. Now, this will have 1,000 beds for non-critical COVID patients at the BKC exhibition ground in Mumbai. The hospital will have facilities like a pathology lab to conduct blood tests on patients. If required, and the hospital in this particular BKC ground can have up to 5,000 beds eventually. But initially, it is going to start with a 1,000-bed facility. The makeshift construction is supposed to be completed within 15 to 20 days. So, Neha, coming to you on this, the point is, as Disha was saying, that the government is focusing on institutionalized quarantine, say for certain areas like the slum areas. All those who have COVID symptoms will have to be compulsorily quarantined institutionally, which means they cannot remain in home quarantine. That is being done to prevent the spread. But for that, beds have to be created. Tell us more about this new facility that we are talking about in the BKC ground in Mumbai.
That's right, Afrika. As you pointed out, the larger picture here is to create more facilities, more beds, more institutional centers in the city of Mumbai, that if at all there is a further rise in the risk cases or in the number of patients testing positive, those facilities are provided in the city for these patients. Now, specifically about the 1,000 beds that have been made by MMRDA, remember this is an initiative, this is a help that the BMC had asked MMRDA to give them so that they will have additional institutional quarantine centers. Now, this is for obviously patients who are asymptomatic and therefore they can be given the due care. Now, we understand that the large ground here, which is in the BKC, which is a very industry heavy complex of Mumbai. Now that ground is being converted into a mini hospital where all the required hospital facilities will be given to the patients. We understand the MMRD authorities tell us that it will be ready in the next 15 days because the construction activities are still going on. And similar to this, Frida, NESCO exhibition ground in Goregaon, all the other major playgrounds and run schools are also being identified so that due facilities could be made there also, if at all there is an increase in the number of COVID cases in the city.
All right, thanks for joining us, but do stay on with us, Neha and Disha. We keep coming back to you for updates. I want to bring in Mayuresh at this point. Mayuresh, like we have been saying, Maharashtra is the worst affected state. Over 700 cases reported in the last 24 hours. That, of course, would be a cause of worry. But what is even more worrisome is that places like Pune, cities like Pune are throwing up big numbers. So there are quite a few hotspots across the state. Mumbai, Pune and Thane, as we have witnessed, is in the list of the 15 most worst affected districts across India. So 3 of those districts are in Maharashtra. What are the major areas of worry? You are sending us updates about how certain areas like Navi Mumbai now taking this step not to have people come back from Mumbai. The mayor has put in a letter to this effect to the Maharashtra government. Many such measures are being taken, I believe. Over to you for the latest on this, Mayuresh.
Certainly, in the last 24 hours, more than 700 cases got recorded from the Maharashtra. As we were speaking about the hotspots, Mumbai, Nagpur, Pune, Palghar, Thane, Nasik. These are the main hotspots in the state where continuously we can see that there is an increase in the numbers of COVID positive patients. If we talk about the Pune, yes, Pune has already crossed the mark of 1,000, and that's why Maharashtra government is now basically focusing on 2 major cities. That is, one is Mumbai. All efforts are really on in the Mumbai, especially in the hotspots like Dharavi, Sion, Kolivada, and other hotspots in Mumbai city. There are more than 600 to 700 containment zone itself in Mumbai. But now Maharashtra government is basically focusing on Pune also, and that's why they have appointed 4 senior bureaucrats to look after and help the Pune commissioner and divisional commissioner. Also, as Disha was telling, that in Mumbai, basically Maharashtra government is increasing the infrastructure. They're increasing the institutional quarantine facility. Similarly, in Pune, now the Pune corporation and state government has started building, and they're focusing to increase the institutional quarantine facility, because in the slum area, at every house, state government cannot reach, or their machinery cannot reach. That's why their attempt is to get the people out of slum area and put them into the institutional quarantine facility at least for the 15 days, so that they will get a good treatment. They will be under observation of doctors.
All right, Mayuresh, Disha and Neha, thank you so much for joining us with your respective inputs on the various aspects that you're tracking on the coronavirus cases in Maharashtra. We continue our focus on Maharashtra, but let's now move on with other